Good morning, good afternoon, and good evening. I'm Constanza Moreno Fernandez, and I'm happy to facilitate the following two conferences for Africa region. Thank you to each of you for being here with us today. We hope that you and your families are safe during these uncertain times in the middle of the COVID-19 pandemic. On behalf of the International Society of Pharmacovigilance, ISPO, we are very pleased to welcome to all of you to the ISPO Patient Safety Day event that starts since yesterday and will finish today. The COVID-19 pandemic has unveiled the huge challenges and risks health workers are facing globally. Therefore, the ISPO engagement is to develop and share these safety awareness sessions to different audiences, patients, caregivers, and healthcare professionals, with the aim to increase safe use of medications and avoid medication errors around the world. It is now my pleasure to introduce our President, Mira Harrison, who will address you with a few words.
Hello, welcome to this ISOP webinar on World Patient Safety Day. My name is Dr. Mira Harrison-Woolrich, and I'm the President of ISOP. Thank you for joining us for this series of very interesting events to discuss what ISOP and our colleagues around the world are doing to focus on this very important day. World Patient Safety Day began in May 2019 at the World Health Assembly. All WHO member states endorsed the establishment of this day to be marked annually on the 17th of September every year. The reasons for this were quite outstandingly clear. If you look at these statistics that I've placed on the screen, there are many things that we really do need to address in pharmacovigilance. For example, 134 million adverse events occur every year in patients in low and middle income countries. 2.6 million deaths annually are due to adverse events. 15% of hospital expenses in OECD countries are due to treating patient safety failures. 4 out of every 10 patients are harmed in the community setting worldwide. So this issue, which is not just restricted to adverse events associated with medicines, but more generally to patient harm, it's not just restricted to hospitals, but also to community settings around the world. The aims of World Patient Safety Day are to recognise patient safety as a global health priority, to increase public awareness and engagement, to enhance global understanding of patient safety, and importantly, to spur global solidarity and action to promote patient safety. All of these aims, which were derived by the World Health Organization, align strongly with the missions of our society, the International Society of Pharmacovigilance, which is to protect patients from harm by promoting the safe use of medicinal products worldwide. I'd like to just tell you a little bit about ISOP, because I realise that many of you tuning in today will not necessarily be members, because we have opened up these events to everybody for free of charge. But our society, in summary, is an international non-profit making professional organisation aiming to promote drug safety scientifically, clinically and educationally in order to enhance all aspects of the safe and proper use of medicinal products. In this definition, we include all drugs, vaccines and medical devices. And I should say that includes drugs which are sold over the counter and herbal medicines as well. And we aim to cover all countries. We currently have approximately 800 members in approximately 100 countries worldwide. We have regional chapters in Africa, Asia, Europe, Latin America, Middle East, USA and Western Pacific. We also have a number of very active special interest groups. These webinars are being produced by our medication error special interest group, and we have other groups that discuss herbal medicines and women's medicines. So if you are interested in joining ISOP, there's plenty of ways in which you can contribute to drug safety by being involved in these regional chapters or being involved in the ISOP special interest groups. Do have a look at our international website, which is on the screen now, isoponline.org, and look at the membership page and do think about applying if you're not already a member. So I'd like to move now to how can we work together this year, 2020, to reduce harm to patients worldwide. It's a very important year in medicine safety with the current pandemic crossing our world. And maybe the first thing to say is what we're all already doing here at this meeting is participate in these World Patient Safety Day events to start to learn what's happening worldwide in your country, in your region, and across the globe. So let's try to become educated, first of all, on all the key issues affecting patient safety in our countries. For example, are there issues with access to safe and effective medicines? Are there issues with medication errors, prescribing issues, or compliance issues? Or are there, and this could apply equally, special and specific safety issues with particular medicines, devices, or vaccines? The next thing we can do is to remember to report suspected adverse drug reactions to all medicines, devices, and vaccines. In most countries, there's a national authority where you can report any adverse event, and this information is available online. As I was saying earlier, this year is a very important year because of the pandemic and issues with vaccine safety and medicine safety. So think about joining a professional society such as ISOP to collaborate and share information with your colleagues. And the next and perhaps most important thing I have to say about this is to start some conversations about pharmacovigilance, about medicine safety in your pharmacy or your clinic. I'd like to just share with you now one example of what ISOP has been doing to start these conversations about medicine safety. Throughout this year, we've developed the image which is on your screen now, which is an infographic about using medicine safely during the COVID pandemic. This was developed by a group of us within the International Society of Pharmacovigilance, and we wanted to try to communicate 4 key messages about using drugs and other medicines at this time. And you'll see on your screen there are 4 areas that we have focused on about where you access medicines from, how to act on side effects of medicines, how to stay safe and healthy. This is a really important point because a lot of people actually start using medicines differently in times of crisis and pandemic. And lastly, being aware of fake news, of wrong information, and directing people to information sites which can be reliable and can be trusted. We also developed this infographic in several different languages, and I will just show you some of these now, because we are aware in our society, although English is the official language of ISOP, many of our members around the world, of course, speak different languages. So I'm just showing you now on your screen the infographic in different languages. And these are all available on our website, on the ISOP website, which is now on your screen, and they also can be found on our social media platforms. Please do take a moment to have a look at them. Feel free to download them, print them out, and use them wherever you can to promote patient safety in your country. So just to wrap up this introduction, as the webinars commence, please think about the following things. This day, World Patient Safety Day, is a really important reminder to all of us of the need for continuing work on protecting patients from harm in all countries, wherever you work. Do enjoy and learn from the presentations by the ISOP speakers and by our international collaborators during the series of webinars. The WHO estimate that up to 80% of harm to patients can be avoided. That's such an important statistic because it means there is a lot of things that we can do. So implement what you've learned in these seminars, take them back to your country and implement them in your healthcare community. And again, please consider joining ISOP, and we'd love to have you join us in our society and become engaged in all the activities that we have to offer. And the last thing to say before we start the programme of events is please remember that every day should be World Patient Safety Day. Thank you for your time, and thank you for listening, and I do hope you enjoy the remainder of the events.
Now, let me introduce you to Dr. Yvonne Yirenkyiwaa Esseku. She is pharmacist, pharmacologist, lawyer, management consultant, and educator. She has experience in leadership, governance, policy, and human resource management. She has been involved in the development of policy and training documents and has led and participated in the drafting and review of constitutions and bylaws for a number of organizations. She has particular interest in the nexus between effective environmental practices and the handling of unused and expired pharmaceutical practices on the one hand, and the pharmacological effects of inadvertent exposure to pharmaceuticals on individual and public health on the other. In this regard, she has designed the drug disposal flow diagram, a tool for assessing the environmental impact of poor disposal of pharmaceuticals. Dr. Yvonne is currently the Rector of the Ghana College of Pharmacists. She is a Fellow of the Ghana College of Pharmacists, Fellow of the National Safety Council, Ghana, member of Pharmaceutical Society of Ghana, member of the Pharmaceutical Society of Pharmacovigilance, Counselor of the Commonwealth Pharmacists Association, and Editor-in-Chief of the Ghana Safety and Health Journal. She will present her conference entitled Patient Interaction with Healthcare Professionals and Medicine Safety. We invite you to actively participate during this presentation. If you have any questions, please ask them in the chat on the right. We will be responding to as many as we can during the allotted time. The rest of the questions will be answered and published in our Q&A section within Patient Safety Day training on our webpage, isoponline.org. Without further preamble, please give a warm welcome to Dr. Yvonne Yirenkyiwaa Esseku.
So today we are going to look at patient interaction with healthcare professionals and medicine safety. And my name is Yvonne Yirenkyiwaa Esseku. And we will just outline briefly, we'll look at some introductory matters, look at the investigations that were undertaken with respect to the interactions that patients had with healthcare professionals. We'll look at the results and their implications for medication safety and how we can promote patient safety. So the WHO identifies patient safety as the absence of preventable harm to a patient during the process of healthcare and reduction of risk of unnecessary harm associated with healthcare to an acceptable minimum. But the WHO recognizes that the acceptable minimum may differ from community to community, from one group to the other, based on the current knowledge, the resources that are available, and the context within which the care is delivered. Medication safety is the effective use of medication without the incidence of preventable harm. As has already been mentioned, 4 out of 10 persons who seek healthcare in ambulatory and primary care settings are estimated to be harmed as a result of their health-seeking behavior. And 134 million adverse events occur in hospitals in low and middle income countries. This, the WHO estimates, costs the whole world an amount of about $42 billion. So this is an issue that must be tackled. So let's look at the investigations with respect to interactions. Now, we all know that when patients seek healthcare, during all the steps of health seeking, they will interact with healthcare professionals. And when it comes to taking medications, they will interact particularly with prescribers and dispensers. And so the focus of this presentation was on that interaction between healthcare professionals, that is prescribers and dispensers, and the patients who sought healthcare. Now, it is important for these interactions to take place because they give the patient a clear understanding of the medications they are taking. It will reduce unnecessary polypharmacy. We do know that there are some instances where patients will have to take more medicines than their compatriots may be taking. But in some instances, it is unnecessary. And it will also avoid adverse events which may result from different drugs interacting with each other, some drugs having some effects on conditions that may be existent in the patient, and some foods that the patient may be taking which may interact with the drug that they are taking. And of course, when these interactions are of optimum quality, they will result in optimum health outcomes. So what happened with this investigation is that we interviewed patients and clients who had accessed healthcare in hospitals, clinics, and pharmacies. And we found out from them the kinds of discussions that they had with the healthcare professionals they had interacted with. And we also looked at the labels of the medicines that had been dispensed to them to see whether the communication that had been put on the label would be sufficient to give them good references if they needed to. And what we found and their implications for medicine safety are as follows. Now, in Ghana, we have about 50 distinct languages, and each of these languages have some dialects. So considering when you put this into focus, it is very possible for language to be an issue when a healthcare professional is interacting with a patient. And so it is a potential source of miscommunication. But all the people that we identified stated that the interaction that had taken place between them and their healthcare professionals was in a language that they understood, which was fantastic. Now, of course, once the language is what the client understands, they will understand the directions that have been given on the use of the medication. They will remember the directions, in any special directions that may have been given, and they are likely to recall actions that they should take in the event of an adverse drug reaction. Now, we also found out from them whether among the issues discussed, allergies they may have had been mentioned. 15% of the respondents said allergies had been discussed, and 85% said allergies had not been discussed. Now, we asked them, and of the people we asked, more than 20% indicated that indeed they had allergies that they were aware of. So this then creates a problem, because if the issue of allergy is not discussed, the client may spend money on medicines that they will not be able to take because of allergies. And if the allergic reaction is severe enough, it may result in hospitalization or prolongation of the disease state. And it is possible that, in fact, that is what is likely to happen, that the client will stop taking their medications once they see some adverse drug reaction. And of course, this is not good. And this is will result in poor patient safety. And of course, there will be no medication safety. We also wanted to find out from our respondents whether they had been questioned in their interactions with healthcare professionals on other medications they may have. And 29% said yes, they had been asked, but 71% said they had not been asked. Now, we do know that medications may go by different names. And if a professional has not questioned and the patient is not aware that some medication they may already have is being prescribed or being dispensed to them again, they are likely to take these medications together, and this will result in higher than needed doses, which can result in adverse drug reactions for the patient. Again, the medications may interact with other medications, not just by adding up, but what could happen is that they will result in a negation of the desired effect. In fact, there are some medications that are known to stop other medications from being absorbed. And because of that, the effect for which the medication has been dispensed will not be obtained. So it is important that medications are discussed during these interactions. We also wanted to find out were other existing conditions that these patients or clients have discussed. 48% said it had not been discussed. So you can see that slightly higher, 52% said it had indeed been discussed. We did not go on to find out from them whether they were aware of existing conditions, because we know that there are some existing conditions, some conditions that the patients themselves may not be aware of. And it is in the discussion, the interaction with the healthcare professional, that those kinds of conditions may come out. But we do know that some medications will worsen existing conditions, and some medications will cause flare-ups in existing conditions. So it is important that when medications are being prescribed or dispensed, other conditions that could be affected by those medications should be discussed with the patient. Now, we looked at the labels and we saw that the one thing that was present, the one thing that was absent on every label was the patient name. So there was no patient name on any label among the people that we interacted with. But you see that, for instance, medication name was quite high in a lot of instances. You also see that the dosage regimen, about over 90% of labels had the dosage regimen, but just about 40% or 50% had the duration of the medication stated. And also, when it came to facility information from which the patients could make any other reference or any other, in the event of some adverse drug reaction occurring, from which any reference could be had, well, just about 80% of patients of the labels had those present. Now, of course, if the labels give the correct information, then it will allow for effective referencing so that the patients can go and get the information that they need if they needed additional information with respect to their medication. It will also prevent medication sharing, because once the person's name is on a medication, it is less likely for them to share, or for somebody who would have wanted to share in that medication to go for that. And it will also reduce unnecessary polypharmacy, as all that information will advise the patient or their caregivers on the kind of medication that they are taking and what they should and should not do when taking those medications. So, what is the way forward? How do we promote patient safety? We saw that in our instance, in our case, the language was not a problem, and yet some pertinent issues were not discussed. And the language, the common language, is something that we could leverage on to ensure effective communication of all the relevant information, so that these pertinent matters will always be discussed. And it will also allow for questions if the patient or the client has some questions, and that will result in better clarity and better use of the medication. Then there is also the need for us to ensure that we facilitate feedback by following up on our client, by ensuring that we have informed them on the ADRs that may occur, and also assure them that it is important that they report back, and proper action will be taken once they report any adverse drug events that they may have. And when we facilitate feedback, it allows the patient to discuss any matters. So for instance, if there are any patients or any non-pharmacists or non-healthcare professionals who are part of this communication, this information allows them, the next time they are interacting with a professional, to ask for information, relevant information that may have been omitted in the discussions. Of course, in our settings, that is our low and middle income settings, we know that the healthcare ratio to population ratio is not good at all. And because of that, sometimes there are stresses, and so the patient, the healthcare professional, may need prompting from the patient to discuss some omitted matters. Now, this year, the WHO is focusing on health worker safety, and that is critical, because when the health worker is safe, it ensures that there is sustained healthcare delivery. It promotes confidence in the health worker when providing service, and it assures quality of care. Thank you very much for listening. And if you have any questions or points for discussion, this is a good time for you to share them. Thank you.